Well, lessons learned. Colorado lawmakers are now working to create what they're calling a new healthcare reserve corps. News 5's Andy Cohen explains the goal is to have a dedicated group of medical professionals cross-trained and ready to step in should hospitals become overwhelmed by another health crisis in the future.
When cases of the virus were spiking this past fall, our local hospitals reassigned many of their employees to the COVID floor, some of whom hadn't worked at a bedside in years. The idea of a healthcare reserve corps is to have a group of trained professionals who can fill that need should it come up again in the future. A year ago, when the legislature adjourned because of the first surge in COVID cases, pediatrician Yadira Caraveo went back to her clinic. But children weren't the primary victims of this virus.
There was even some guilt on my part that I couldn't jump in and go and help out at an ICU or an emergency room because I hadn't taken care of an adult patient in years, right, since medical school.
She and State Rep Kyle Mullica, the only doctor and nurse serving in the General Assembly, are co-sponsoring a bill to cross-train hundreds more medical professionals to be able to step in during future crises.
We kind of started formulating some ideas of how could this be different the next time that something like this happens, whether it's a pandemic or a bad wildfire season.
These are some of the sickest critical care patients that I've ever seen in my career.
Back in November, Ira Cronin introduced us to Patty Loper, a nurse at Memorial Hospital. UC Health began its own internal cross-training program months earlier. She told us at the time it was an adjustment.
All of a sudden you get this flip and you're the novice. And these are really, really, really sick patients.
If this bill passes, it will create a task force to research and study the logistical challenges of creating a healthcare reserve corps. Their goal is to have that work turned into new legislation in another 2 to 3 years.
It's the start of a process that I wish had already been in place for this pandemic, but at least we have to learn from this one to prepare for whatever comes next, and that's what we're trying to do.
The bill has already passed its committee vote and gone to appropriations. If it clears the House, it'll be carried in the Senate by Senate President Leroy Garcia of Pueblo, who is also an EMT. Always watching out for you, Southern Colorado. Andy Cohen, News 5.